Thanks for joining this afternoon. My name is Jane Parmley, and I am the Graduate Program Coordinator for the combined DVM MPH program at the University of Guelph. This is a quick outline of what I hope to cover over the next few minutes. I'd like to quickly introduce the DVM MPH program and why it might be of interest to you, provide information about how to apply, and then we will have time for questions at the end. So, why should you consider the DVM MPH program? First and foremost, this combined program will provide veterinary graduates with formal and additional training in public health. This additional training will support graduates working in more traditional clinical settings, as well as those interested in exploring alternative careers in animal or public health. To date at Guelph, 16 DVM graduates have completed the MPH program, often after being in practice for several years. Those graduates are now working in practice with federal government agencies, such as the Public Health Agency of Canada and the International Development Research Centre, with provincial and territorial governments, at local public health units, with non-governmental organizations such as the Wildlife Conservation Society, and in academia. How does the combined DVM MPH program work? Basically, it pairs the existing DVM MPH programs together and enables students to complete the 2 degrees in a reduced number of total semesters. There are no changes to the DVM curriculum. Students enrolled in the combined DVM MPH program will complete the 4-year DVM program as usual, and then complete the required courses for the MPH program in 1 year afterwards. Students who are accepted into the DVM MPH combined degree program will be exempted from the 2 credits of elective courses usually required of MPH students. Some of the public health competencies are addressed through the DVM program itself, particularly in the health management courses, the AVM courses, as well as clinical medicine courses and principles of disease course in phase 2. Additional leadership, communications, and collaboration skills and knowledge are also learned and practiced in the veterinary externship and in rotations that may be taken during phase 4. The purpose of the elective MPH courses is really to provide more in-depth study of public health, and we are confident that the learning outcomes and competencies gained through the DVM program offer this depth of study in veterinary public health. To meet the requirements of this new combined program, DVM students will be required to complete a new One Health module to be offered as part of Health Management 3. If you enroll in this combined program, you will at the end receive 2 separate degrees or pieces of paper. A DVM degree will be issued when you complete the DVM program, and an MPH degree will when you have completed those program requirements. This table shows the course load for the 2 options for completing the MPH program, as well as the course load for the DVM MPH program. Combined DVM MPH students will complete the required MPH capstone course with 0 credit rating during their first MPH semester, rather than after their public health practicum. In the capstone course, DVM MPH students will reflect and present on how their DVM training aligns with and complements the field of public health, a One Health project that they may have been involved with during their DVM training, or on their experience during a public health related external rotation. We will work with you to secure relevant veterinary public health practicums that will maximize application of your DVM skills while providing opportunity to build your public health knowledge, network, and skills. Ideally, the practicum will take place after you have completed the required MPH courses, as it is intended as an opportunity to practice and refine your new public health skills. However, if you are able to secure a practicum placement earlier, for example, in the summer after completing the DVM program, we may consider an exception to the order of the program requirements, and this will be decided on a case-by-case basis. Here are the 9 required MPH courses with their course codes and titles, and you can find more information about these courses in the graduate calendar available online. And this slide shows your course schedule for the fall and winter semesters. The fall semester has a particularly heavy course load, and in addition to the courses shown in the table, PopMed 6200 or Epidemiology 1 will have to be taken as a distance education course to avoid scheduling conflicts. To be eligible for the combined DVM MPH program, you need to meet the admission requirements of both individual programs. You have already met the requirements for the DVM program. You are able to apply to the combined program in either your third or fourth year. If you meet the program requirements, you will be conditionally admitted to the combined DVM MPH program. So if you apply this winter, applications are due February 1st, you will be admitted for fall 2021, but you will then defer the start of the MPH program to the fall of 2022. Your acceptance is conditional on your completion of the DVM program and on completion of the One Health module in Health Management 3. Information on how to apply to the DVM MPH program is available on the MPH website at the link pasted here. As I mentioned earlier, applications are due February 1st and must include 2 letters of reference. Both academic and professional references are acceptable, but one should be able to speak to your potential as a graduate student. Any academic reference should be able to comment on this. When you apply, please make sure you select the DVM MPH option and not the regular MPH option. As DVM students, your applications will be reviewed separate from the other MPH applications. At this time, we plan to accept up to 5 DVM students per year into the MPH program. Your applications will be reviewed by myself, another One Health faculty member, and the coordinator of the MPH program. More information about the DVM MPH program is available on the MPH website, the One Health Institute website, or you can reach out to me directly and I will do my best to answer your questions. That brings me to the end of the formal presentation, and I see a few questions in the chat. Is there a thesis or capstone project, or is it all course-based? The MPH is considered a course-based graduate program, and so there is no thesis requirement. There is, however, a capstone course that the students will need to complete. The requirements of this course are a bit different for DVM MPH students in that they are usually completing this course before they complete their public health practicum. DVM MPH students have a few options to meet this course requirement and can reflect and present on how their DVM training aligns with and complements the field of public health, on a One Health project that they were involved with during their DVM program, or on their experience during a public health related external rotation. When would acceptances be sent out? You should hear in April whether or not you have been conditionally accepted into the DVM program. How much experience in public health specifically would be looked for in a DVM MPH applicant? It's a good question, and likely depends on the number and type of applications we receive. At a minimum, your public health training through the DVM program will meet the eligibility requirements. You should highlight your public health experience through the DVM program and any other additional experience you may have had outside. It is not just your past experience that will be considered, but also your interest in public health going forward. Remember also that the DVM MPH applicants will be assessed separate from the other MPH applicants. Is this something that there is potential professionals could take later? Absolutely. DVM students are welcome to apply to the regular MPH program at any time, and many DVMs have done this. If you choose not to apply during your training, however, you will not be eligible for the combined DVM MPH option. Could you comment on career prospects after the program? Certainly. Several DVM graduates with MPH degrees are working in government, usually in health or public health, but not always. And some are working in academia, some are in practice, and some are working with non-governmental organizations. Veterinarians with MPH degrees are increasingly recognized for their involvement in all areas of public health, including epidemiology, environmental health, and infectious disease investigation and control. They are uniquely qualified to understand and respond to emerging zoonotic diseases, to address global food system problems, and to contribute to building resilient and healthy communities. As we come out of the current COVID-19 pandemic, I believe the skill set that DVM MPH graduates have will be increasingly recognized and sought after. How does this differ from an epidemiology degree? The MPH is different. It offers more practical training focused on public health and really aims to train students for a career in public health. A degree in epidemiology, on the other hand, tends to be more research focused. At Guelph, a degree in EPI can either be thesis-based, which provides the students with more research experience, or course-based, where students will take more courses, but still need to complete a major research paper. Whether the MPH option or a degree in epidemiology is best for you will depend on your career goals and what you hope to get out of the graduate program. I'd be happy to discuss these options with you directly, as the answer is probably different for each of you. Is there a disadvantage to applying in fourth year? Yes, unfortunately, we've been struggling with this issue. At this time, if 5 people are accepted into the DVM MPH program in their third year, opportunities for enrollment after fourth year may be limited, and so there would be a disadvantage of applying later. If there is sustained interest in the combined DVM MPH program, we may explore opportunities to increase the number of spaces available and/or offer alternative pathways to completing the combined program. For example, we may consider an option where students apply to both programs at the same time and complete the MPH program first, prior to starting their DVM degree. However, until we have completed several cycles, we will be limited to the 5 spaces in the order described here.